السالمونيلا. السالمونيلا هي السبب أو leading cause of enteric fever or typhoid fever and enterocolitis and diarrhea in the human. Salmonella are gram-negative motile rods belong to the family Enterobacteriaceae, able to ferment glucose and mannose without producing gas, but do not ferment lactose or sucrose. So on the triple sugar iron agar, this bacteria appear A to A with H2S production without gas. Most produce H2S, they are often pathogenic for a human or animal when ingested to cause enteric fever and other gastroenteritis. Classification of this bacteria depending on several bases, including epidemiology, host range, biochemical reactions, structure of OH and VI antigen. Also, we're able to use molecular techniques such as DNA hybridization technique, which help in the differentiation between different strain and serotypes of this bacteria. Mostly, all Salmonella serotype that infect a human is present in DNA hybridization group 1. According to the antigenic structure, there are more than 2,500 serotypes of Salmonella, including more than 1,400 in DNA hybridization group 1 that can infect humans. The most important serotype of Salmonella that cause enteric fever can be identified in the clinical laboratory by using biochemical test and serological. احنا دائما نستخدم السيرولوجيكال تيست اللي هو موجود حاليا عندنا باستخدام الاميون كروماتوغرافي. Salmonella typhi IgG, IgM antibody, IgG for chronic infection, IgM for acute infection. They are as follow: Salmonella paratyphi A, paratyphi B, Salmonella cholera suis, and Salmonella typhi or enteric. طبعا احنا شباب شنو الاسم العلمي للبكتيريا هي سالمونيلا انتريكا سب سبيشيز انتريكا سيروفار تايف، ولكن بما انه السالمونيلا تايفي هو الاسم الاكثر تداولا منذ اكتشاف البكتيريا لحد الان، واغلب المصادر والكتب والمحاضرات هي موجود الاسم القديم اللي هو سالمونيلا تايفي. فبالمصادر الجديده يعني الحديثه نشوف انه ينكتب الاسم Salmonella enterica subspecies enterica serovar typhi بين قوسين يخلون formerly or previously called Salmonella typhi، ويبقى المصدر يستخدم السالمونيلا تايفي، ولكن السالمونيلا تايفي هو واحده لا يعد الاسم العلمي للبكتيريا. Salmonella typhi, cholera suis, perhaps paratyphi A and B are primarily infect for human, and infection with these organisms like possession from the human sources. The organism always enter through the oral route, usually with contaminated food or drinks. Main infective dose to produce clinical or subclinical infection in human is 10/5, 10/8 Salmonella, but perhaps as few as 10/3 Salmonella typhi organism. نلاحظ اكو اختلاف بين الانفكتيف دوز من 10^5 الى 10^8 رينج كبير، والسالمونيلا تايفي 10^3. كل هذا يعتمد على مجموعه عوامل، من اهم هذه العوامل اللي هي resistant to gastric acidity, normal intestinal microbial flora which can be consumed nutrient that used by pathogen, and local intestinal immunity. All these factors affect the infective dose of Salmonella that initiate infection. Also, the virulence factor of this bacteria play an important role. Now, enteric fever or typhoid fever. This syndrome is produced by only a few of Salmonella. of which Salmonella typhi is the most important. Ingestion of Salmonella or ingested Salmonella reach to the small intestine and enter to lymphatics and bloodstream. And they carried by blood to many organs, such as including intestine. Organisms multiply in the intestinal lymphoid tissue and are excreted in stool. After incubation periods of 7 to 14 days, fever, malaise, headache, constipation, bradycardia, and myalgia occur. The fever rises to high platelet, and the spleen and liver become enlarged. This is characterized by splenomegaly and hepatomegaly. Rose spot on skin of abdomen or chest is very rare or occur in the rare cases. White blood cells count is normal or low at the first 5 days of infection, and they remain to the normal or increase in the progression of infection. Chief complication of enteric fevers were intestinal hemorrhage and perforation. Bacteremia with focal lesion, this is associated commonly with the Salmonella choleraeus, but may be caused by any other types of Salmonella. Following oral infection, there is rarely invasion of the bloodstream with possible focal lesion in the lungs, bones, and nerves. But intestinal manifestations are often absent. Blood culture are positive in this case. Enterocolitis, Salmonella typhimurium, and Salmonella enteritis are prominent, but enterocolitis can be caused by any of the more than 1,400 group 1 serotypes of Salmonella. 8 to 48 hours after ingestion of Salmonella. Nausea, headache, vomiting, and diffuse diarrhea with a few leukocytes in stool and low-grade fever is uncommon, but the episodes usually resolve spontaneously in 2 to 3 days. شباب اكو سؤال لحد الان؟ شباب اكو سؤال؟ اديان حيدر.
واضح انت الدكتور.
احمد جبار. إسراء سعد. إسراء.
نعم دكتور.
شو تشوفين المحاضرة واضحة؟ أكو سؤال عندكم؟
دكتور واضحة. إن شاء الله واضحة.
الآن نأتي إلى ال Diagnostic Laboratory Test. Specimen. طبعا بما أنه الكيسات موجودة سبتسيميا، ممكن انه associate with intestinal infection. First specimen is blood for culture and white PC count and serology. So we take it repeatedly. An enteric fever and septicemia. Urine or stool specimen can be used. Blood used for culture give a positive result during the first week of infection. البلاد كلتشر نستخدمه فقط الاسبوع الاول من الاصابه لما تكون البكتيريا موجوده in the lymphatics and blood. من يعبر الاسبوع الاول راح ينطينا negative result. Also white BC count used for early detection. When white BC low is suspected, the person infected with enteric fever with the presence of other signs and symptoms of disease. The white blood cells in the normal or low. Bone marrow and urine and stool specimen also must be taken repeatedly for diagnosis. In enteric fever, the stools yield positive result in the second or third week. هنا طبعا مثل ما عرفنا بالباثوجينيسيس، البكتيريا لما تدخل الانتستين راح يتم يصير انجولمنت وتدخل الى البلاد ستريم بالاسبوع الاول، فبالاسبوع الاول البلاد كلتشر راح يعطينا بوزيتيف ريزلت. بعد اسبوع راح ترجع البكتيريا وين the intestine and multiply inside the intestinal cells and shed to the lumen. Then the stool culture is become positive in the second and third weeks. Bacteriological methods for isolation of this bacteria, including medium. There are different types of media that are used for isolation of this bacteria. Differential medium cultures, such as using eosine methylene blue, McConkey agar, deoxycholate medium, bismuth sulfate medium, which permits rapid detection of salmonella, which form black colonies because of H2S production. Bismuth sulfate medium help in the rapid detection of this bacteria due to H2S production, while on McConkey agar and eosine methylene blue, the bacteria appear as a pale colony. Selective medium for culture specimen is plated on Salmonella shigella agar or SS agar, Ecton enteric agar, XLD or deoxycholate citrate agar. The most useful media known is XLD, xylose lysine deoxycholate agar, while SS agar is not recommended now for diagnosis because of has low specificity and sensitivity. Also can be used enrichment culture. The specimens are usually stool also is put into cylinder F broth or tetrathianate broth. Because of the stool is containing a high number of normal bacterial flora, so we needed to inhibit this bacteria and enhance the growth of pathogen. Cylinder F broth, tetrathianate broth help and the inhibition of replication of normal intestinal bacteria and permit the multiplication of salmonella and enhance the growth of salmonella. So after an incubation period for 1 to 2 days, this is ablated on selective. The specimen is ablated or subcultured on selective and differential media. Serological method or technique are used to identify unknown culture with known sera and may also be used to determine antibody titer in patients with unknown illness. Although the latter is not very useful in diagnosis of salmonella infection. طبعا serological test ينقسم عندنا إلى قسمين، قسم هو الانتيجين detection والantibody detection. Antigen detection using for detection of colony on the agar plate, while antibody detection for detection of anti-salmonella antibody and the serum of patients. By using Guidal test or by using ELISA technique, immunofluorescence, now in the Iraqi labs we used immunochromatography technique by using cassettes. Guidal test or tube dilution agglutination test is an old test used for diagnosis of Salmonella. At least 2 serum specimens obtained at interval 7 to 10 days are need to prove a rise of antibody titer. Serum two-fold dilution of unknown serum are tested against a antigen from representative Salmonella, and the results are as follows. High or rising titer of O antigen 1 to 160 suggests the active infection is present. High titer of H antigen suggests past immunization or past infection, and high titer of antibody to VI antigen or capsular antigen occur in some carrier state. And the results of serological tests for salmonella infection must be interpreted cautiously. The best possible presence of cross-reactive antibody limit the use of serology in the diagnosis. The gold standard method for diagnosis of bacteria is culture techniques, especially blood culture at the first week of infection. Treatment. شباب اكو سؤال بالنسبه للدايجنوزز؟
واضح دكتور.
يعني الدايجنوز واضح جدا، لان في نقطه جدا مهمه انه عندنا استخدام البلاد كلتشر. الكلتشر في الاسبوع الاول نستخدم بلاد كلتشر لانه البكتيريا وين تكون موجوده in the lymphatics and the bloodstream at the first week of infection. And the second and third week, the bacteria return to the intestinal tissue and multiplied inside the intestinal tissue. So is excreted inside the gut human and can be detected in the second and third week by using stool culture. واضح شباب؟
واضح دكتور.
طبعا احنا هسه حاليا استخدام الستول كلتشر او البلاد كلتشر جاي نشوفه قليل. اكثر الاعتماد بالتشخيص هو على الكلينيكال برزنتيشن and serology by using immune chromatography cassette for detection of anti-salmonella IgM and IgG. طبعا اذا يظهر الاي جي ام معناته عندنا اكيوت انفكشن، الاي جي جي بوحده والاي جي العفو الاي جي ام والاي جي جي معا نشوف انه اكو فد كرونيسيتي معينه او كارير ستيت ممكن انه نلاحظها in the case of presence of IgG only in high sorry in low concentration.